How are you guys?
I know I'm doing good today.
My God, I'm frazzled, so I'm just going to tell you that right now. But it's okay. It's quite all right. Today is Wellness Wednesday, and I'm so excited because, of course, we have Dr. Hollis today, and we're going to continue our conversation about eye health, which is simply amazing because who talks about that stuff? And so, we're going to talk about floaters in the eyes. We're going to talk about eye twitching. We're going to talk about bags and circles under the eye and what all that can mean because the eye tells us a whole lot more about our health than we even realize. And so Dr. Hollis and of course Crystal is going to be here to help us with that. But before we get started, we're going to absolutely start our program today, our Wellness Wednesday, with her testimonial. And I have to say, the reason why we do this every time, I know some of you have heard it a million times, but because we get new videos every time, we get new people every time, and something else comes out of her testimony that may not have been said before, or somebody needs to hear something out of that testimony again or for themselves. You just never know who's hearing what they're hearing at the time they're hearing it. And that's why it's really important for her to tell us what her journey's been. So, hi, Crystal.
Hey, how is everybody?
So if you could go ahead and start with your testimony, that'd be great.
All right, all right. Well, I am a natural health and herb specialist and a holistic health coach. And the reason I started this is because years ago, when I was 18, I was diagnosed with ulcerative colitis, which is an inflammatory bowel disease. And it really affects more than just your bowels, and I lost over
There you go.
30 pounds in a month. You know something's wrong when you're losing that much weight so fast. I was pale, looked like death, had to be hospitalized. And the first time I was hospitalized, we did all the tests, the colonoscopies and things like that. And I was 18. I recovered quickly. Wasn't in the hospital that long.
Right.
But I did take the ulcerative colitis medications they recommended, and I took the steroids they recommended. And you know what? Those things actually just made things worse. The pain wasn't going away. I wasn't getting better, and I couldn't understand it. Not one doctor talked to me about nutrition, stress, lifestyle change, anything like that. They just give you a pill basically, and just to let you know, in 10 years you might have cancer from this, and you'll have to take medication for the rest of your life, and you could possibly have to wear a colonoscopy bag, or whatever you call it.
Colostomy bag.
Colostomy bag. That's sorry, I said it wrong. But anyway, yeah, thank you, Kathey. But yeah, and I was like, I'm 18 at the time. I'm like, this is stupid.
Yeah.
I am not going to be doing this.
Yeah.
So I found a naturopathic doctor, Dr. Inga Wetzel, who we've had on the show before, and I met her at a church event. She was teaching a class about the colon, and I just recently got diagnosed with colitis, and I was looking for answers. I was on the internet, and Google wasn't that great back then. You didn't get that. I mean, you still 2007, 2006, you didn't get that much internet service like we get now. You can just look up anything now and you got all these articles, right? That wasn't like that back then. I searched for diets. I searched for all kinds of stuff. But I went to her class, and she was basically saying everything I was going through. I was like, oh my gosh. I was like, this woman knows everything probably about me, and she hasn't even met me yet. Like, she just knows so much. And I was like, that's what I'm experiencing. I need to see this woman. So I scheduled an appointment with Dr. Inga, and she did iridology on me, some biofeedback and muscle testing, all kinds of things just to figure out, what was going on with me. I had told her nothing. She literally knew I had problems with my colon. She knew I was anemic. That the doctors also told me that while I was in the hospital. She knew all these different things about me that I was just like, wow, just by looking at my eye, you can tell all that, right? And so it got me intrigued. I felt like she knew what she was talking about, so I listened to her. I did a diet change. I tried to eliminate stress, but that was I was young. How do you, what's stress? How do you know what I mean at that time? So I got better, actually. Started taking some enzymes, different things, a protocol she put me on, and I got better. But then I got a divorce, things happened. I've had another flare up. And it was worse this time. I was hospitalized for about 8 days, which was terrible. Went through a lot in the hospital. did the medications again, tried to do that again, still wasn't working. I was like, I need to get back to what Dr. Inga said. I need to learn more. I need to remember this stuff. So after I got out of the hospital, I saw Dr. Inga and I said, I feel like I'm dying. I need your help. I need to learn and do and know everything. I was divorced at the time, had to take care of a 2-year-old. It was hard. So I did what I could. I was like her, what do you call it, apprentice or something. I learned, I learned everything I could know about herbs, and I took classes. I got educated, and I was like, I started healing my body. And I no longer have ulcerative colitis. Their inflammation level is down in my body, where they said, oh, it's probably going to be up here and that's probably your norm. No, that's not normal to have inflammation in my body. And so I kept eating the right way. I kept eliminating things. You know, guys, this happened over time too. I did not fix everything all at once. Like, I didn't know I had to stop eating gluten. I didn't know I had to stop eating dairy, all these refined sugars and carbs and things. And I had to learn that. And trying to shorten this story up, I know it's taken forever for me to say it. But,
no. I mean, dairy and sugar and carbohydrates that are not coming from fruits and vegetables are the worst things in the world for your body. Absolutely. And your body tells you how bad it is. It will definitely fight you back. If you've seen that commercial,
right?
People are fighting the food, or the food's fighting the people after they've eaten it. That's true, actually. And I know that a lot of you have experienced it. If you drank some milk, or if you drink milk, then you know sometimes you got to run to the bathroom. If you eat cheese, and you know sometimes you got to run to the bathroom. If you eat pork, then you know that your joints and your fingers are going to swell up because of all of the salt that's in it, and just pork is not the best thing for you. And so yeah, the body will tell you.
Absolutely. So long story short, I changed all these things, changed my lifestyle, and I healed my body, you know, and I went through other things too. And going through all this taught me so much to share with everybody. And I knew if I could heal myself, that I knew I could help other people. And so that's why I got educated, and I started sharing about herbs and educating other people, like what I knew and what I learned. I just keep going, you know, and that's why we do what we do today, is because you don't have to take medications. I'm on no medications. I just take herbal supplements. I make sure I eat the right diet that's meant for me. And I do know how to eliminate stress and deal with stress a lot better than I used to. And all kinds of things. It's holistic. You take care of the whole body, and it comes into balance. And that's what I've created. And I want to help others to create balance in the body.
Yeah. Well, today I'm excited about our absolute guest today. I'm always excited to have Dr. Hollis. Can you please add him on with us?
Absolutely.
His time is so valuable, and I'm so appreciative of him taking his time with us on a regular basis. We have him once a month. And actually, Dr. Hollis, when I do talk about our show, your shows, the shows that you're on, are the ones that I send out to people.
Thank you.
We love our time with you. You have so much knowledge, and there's so much everybody can learn, including us, you know, and I love how we all interact together. It's great.
Yeah, he's my little brother from another mother, I tell you guys.
Absolutely. Two peas from a pod.
Yeah. Okay, so Dr. Hollis, I did send you a question about, someone had a question for me, not about the eyes. So I'm going to backtrack a little bit. It was about some kind of breathing mechanism that this lady had. I told her that I was going to ask you on air, and have you kind of speak on that before we get on our subject. Do you need me to read the question, or do you have a?
Nope. I have it right here.
Okay, perfect.
Do you want me to read it out loud or just answer it?
I want to know.
Oh yeah, they have to know what you're answering. So yeah, if you go ahead and read it, and then answer it.
Okay. So we have a question regarding a special treatment that a person wants to know whether or not it's natural, whether that it's effective, or anything like that. So for a little bit of background, we're wanting to make sure that this is in relationship to general wellness, immune system health, and possibly related to either preventing or surviving COVID, or what we call post-COVID syndrome. There's some context that is all over the place, and I'm wanting to keep this in a general wellness context. So
hers is battling cancer.
okay, specifically just cancer.
Yes.
Okay.
Yeah.
So one of the most important things about
far as I
cancer
know.
cells is they cannot live in certain environments.
Correct.
They cannot live in oxygen-rich environments, which is one of the reasons why we use the hyperbaric oxygen therapy chamber. I have not met this person, or I would have already offered that to her. But her question says that she has been taking a solution of lye, and she has been using a machine that creates a breathable gas from the solution. She was told by someone that the solution, when it is vaporized, is creating a rich hydrogen gas, and that she is inhaling that in order to supplement her body's level of hydrogen in her body. This is a very interesting question. It is brand new to me. I'm not going to say I've heard it all or seen it all, but I have very rarely these days come across anything I have never heard of before. And after 17 years, I have never heard of this.
Neither have
So
I.
let me tell you what my research has already uncovered. Just to cover a little bit of the legalese.
Let me tell you a
It
little
is
bit about that
not-
lady. She's really smart too. So she's
Yes.
extremely intelligent. So that she's no fly by night kind of person. So she's highly intelligent, very educated. So go ahead. I'm sorry. I got to give you a little background on her.
A lot of people for a very long time have used a food grade hydrogen peroxide solution to supplement their diet or their body's natural defenses, which does show a lot of promising research from many countries to help with cancer and a number of other illnesses and conditions. However, I have not run across any research or any type of confidential or concrete information that says that vaporizing a lye solution to breathe in the hydrogen is an actual treatment, or whether it's safe, or whether that it is condoned by any medical field or any medical institution. In fact, to answer her question, I am more concerned that it is unsafe than it is safe. One of the things that we like to make sure we discuss, especially with patients, is whether or not it is called GRAS. GRAS stands for generally regarded as safe. That applies to a lot of things like medications, herbs, homeopathic medicine, things that Crystal knows all about. This is not considered under the GRAS category. In fact, I had a very hard time finding any research on it at all. Most importantly, the effects of hydrogen in the body can be detrimental, particularly since it is not one of the gases that we breathe in high concentrations normally. So hydrogen is less than 0.00005% of the normal air that we breathe. So saturating your atmosphere with raw hydrogen molecules, I think, in my opinion, is going to be more dangerous than beneficial. So to answer her question, I would say no, I do not recommend it, and I do not suggest it to her for treatment of cancer, or even to boost her immune system to help her recover from cancer.
Gotcha.
Now, if her question was hydrogen peroxide, that would be a different conversation. There are some promising test results as well as research that shows that that can be beneficial, but it has to be done under the supervision of a doctor. It has to be done very carefully, and we have to calculate the amount very carefully. The food grade hydrogen peroxide concentration is very high, and we're talking about drops, as in individual drops in an entire 24-hour day, not something like large quantities. So no, I do not support her using the lye solution to create a rich hydrogen nebulizer, so to speak.
Okay.
In fact, the hyperbaric oxygen therapy chamber would do probably the same thing she's wanting to accomplish without any risks to her at all.
Okay.
All right. That's a good question, because like,
yeah, it was very interesting. That's the reason I'm like, I'm gonna let him handle that.
Thank you.
Okay, so I wanted to talk about the continuation of our eye health
Yes.
conversation that we had about 2 months ago before our Christmas and holiday breaks. And we hope that you had a wonderful holiday break, Christmas, New Year. Happy New Year, by the way.
Thank you. Happy New Year.
Happy New Year.
Okay, so we were going to talk about the bags under the eyes.
Yes.
Circles under the eyes, eye floaters, and twitching of the eye. So I don't care which one you tackle first. If you want to go one into the other, that's perfectly fine with me.
I'm a bags and circles kind of guy.
Okay.
Most importantly, as a continuation of what we've said before, this is one of those situations where the scientific evidence does not always point in the same direction for every person, for every situation. Okay. I can probably think of 25 different causes of the bags or the circles, and they're never going to be the same for one person next to another. And sometimes it's different for the same person on different years apart. But to summarize what I call the big picture, the quotation marks, I like to mention that anything that affects the orbital socket, anything that pools the edema or the fluid that is underneath the eyes that either makes a dark circle in coloring or actually makes a bag that's puffy and poofy, it is always going to be an immune system reaction, but more specifically, an inflammatory reaction. The most important reason for that, the reason that this part of the body is watched so closely, is that it involves the orbital socket, which is right up against your brain, which is inside of the orbital cavity. So there is a bone, there is a barrier that encompasses the whole back of the eyeball, but it is directly up against the brain tissue, and it has very high blood flow straight off of your carotid arteries that come up from the heart. And when there's high inflammation, the eyes are very sensitive to pressure changes. It's also very common window into thyroid conditions as well. So the overlap of trying to use this as a diagnostic criteria, we have to be very careful with. We don't like to call it diagnosis or diagnostic criteria, but it is a window into the internal medicine health of the patient. And the top three things to answer your question is going to be systemic inflammation, which is generally caused by autoimmune disease, like with Crystal, or a regular food allergy that has not become an autoimmune disease yet. We would call that leaky gut syndrome. The second most common is going to be a situation where the blood has developed some sort of an unhealthy trait. Sometimes it is going to be a vitamin or nutrient deficiency. A lot of times it's a problem with the red blood cells. The red blood cells that carry your oxygen, a lot of times there's a problem with that. It could be anemia, but not always anemia. The third most common is a situation where there's an intracranial pressure increase, which is usually a hormonal problem coming from the kidneys. There's a high blood pressure or hypertension. And more importantly, there's something that's causing swelling of the brain pan, and that pushes everything towards the outside, and the fluid will pool under the eyes. We see this in a lot of headache and migraine patients because their brain is always swelling. That's the shortest version of what I call the top three. Again, there could be 10, 15, or 20 other reasons, and they do overlap quite a bit.
I love that you touched on all those points. I was going to say, usually with dark circles, I usually look at the adrenals. Right. And I look at, like you said, food allergies. And what happens is we have food allergies usually because we have probably an overgrowth of bacteria in our gut, which causes all that inflammation, the dysbiosis, the SIBO. And a lot of times we can get rid of, when we get rid of that gut bacteria, there's a gut-brain connection. So that's where And then you have your kidneys, where if you have the puffiness under the eyes, that's usually kidneys or liver, depending on where the puffy part is. If it's a squishy part right underneath the line of your eyelid or whatever, and then if it's big and puffy underneath, that's usually your kidneys. I love working with herbs.
So we're talking about these organs that are doing their jobs, but when you're saying it's probably your kidney, it's probably your adrenals, tell me what's going on with those organs that's causing that issue to show up in the eye. I mean, so what is your kidney? What does that mean?
What she is referring to is what we would consider an abnormal kidney situation. So yes, it is still doing what it's supposed to, but it's either being overworked or it's under producing.
That's what I mean. We need to know what it is that's happening.
Lack of lymphatic drainage, lack of kidney drainage, you're still, releasing toxins and everything.
Kidney congestion, anything that has anything to do with poor kidney filtration. So
medications can overload
anything that damages the kidney, toxic exposure, chemicals, even paint, new carpet, new paint, anything that causes the blood pressure to be affected, which is a secondary effect of an adrenal gland insufficiency as well. So if your endocrine system, your thyroid or your adrenals is messed up, overstressed, out of whack, the kidneys always follow it, almost 100% of the time.
Say that again, please. Say that again, please. Say it again.
When your adrenal system or your thyroid system, which are the two main parts of your endocrine hormone system, when they are overworked or fatigued or damaged, the kidneys almost always follow suit. People think the kidneys just filter the blood for toxins, and that is what they mainly do. But they also secrete hormones. The main one is called ACTH, and that hormone controls blood pressure, fluid volume, your actual quantity of blood in your body, and it maintains the blood pressure and the intracranial pressure of your brain and parts of your brainstem and your spinal cord. So whenever we have a migraine patient, especially if they have bags under the eyes, we always go to the kidneys first. So we're using the outside signs of the body to give us a window into where the problem could be. I usually go straight to acupuncture. Miss Crystal, she uses the herbs. And of course, we're learning from each other as we go. But kidney is always going to be related. And to be honest, I hate to sound cliche, but every person that's still alive walking around on the planet should probably do more to help their kidneys and detoxify, and they will live longer if they take time now to support good kidney health.
Right. And when you're drinking something else besides water, your kidneys have to filter that. You have to understand that. It's not, and on top of that, your liver also has to filter those things.
The best way for me to explain the kidneys, which is slightly different than the liver, the kidneys take everything that's in your blood, every vitamin, every mineral, every protein, and they take all of it and they filter it out, leaving just the water. Then they selectively put things back in that continue on to the rest of your body. Things that you would expect, like sugar and vitamins and minerals, but also other things that you don't want. Some of them are waste products, like the side effects and the chemicals in pharmaceutical drugs. If anyone is taking even one pharmaceutical drug, please call one of us and talk to us about trying to get away from that drug. They will shorten your lifespan, even if the other doctor told you that they will make you live longer. You're robbing Peter to pay Paul. You may help one condition, but you're going to create 3 other conditions. Exactly. But back to what I was saying about the kidneys, they selectively add things back in. And part of that is that everything else has to go out through the urinary tract. It is a toxin at that point. It has to be held by the kidneys, collected into a serum solution called urea, and that is the main constituent of urine. And then it has to be transported out. And the whole time it's being held, your kidney is receiving toxic damage. So just like the air filter on your car, if you never change the air filter, you'll be choking your engine. If you don't clean out your kidneys and keep the filter new and clean, you will shorten your life. You will become very, very toxic.
Wow. That's huge, you guys. I hope you heard that. Wow.
You know, it's funny you said, I always use that analogy, the body robs Peter to pay Paul, because a lot of people, what they don't know is, for instance, if you have arthritis, your knees need sodium actually in the knees. And where's most of the sodium in your body? It's in your stomach. Right. So if your knees don't have enough sodium in them, it's going to take the sodium from your stomach that your stomach needs to produce those enzymes and everything to digest and whatever. You know, it's going to take that from your stomach for your knees, so your knees won't and your joints won't hurt. But what happens is when you start taking from the stomach and you're not able to digest anymore, then you start having like possibly, you know, digestive and intestinal issues. So yeah, that's where your body is going to take what it needs to get to where it needs, you know. And if a woman, she's pregnant, you know, the baby needs nutrients. It's going to take from the mother to feed that baby. That's why you hear sometimes women, their teeth go bad when they're pregnant. It's because their malnutrition, the baby's taking the nutrients from them, and your teeth tell a lot about your health. They're connected to a lot of organs. So
yeah. All right. So that was, I was going to say, did you touch on both the circles and the bags, or was that both?
I was just going to tie that in. Okay. So when the kidneys are involved, they cause a surplus of edema, which is a special type of inflammatory fluid, similar to mucus, but it's clear, it's not sticky, and it's not cloudy. And that will pool in any part of the body that we call an extremity. The legs is the most common. Everybody's heard about the swelling of the legs, especially if it's during pregnancy. But people also get in their hands and their elbows and their knees. And a lot of times my arthritis patients who come in and they say, why do my knees hurt? I ask them about their kidneys and they look at me really funny because they think that I'm some sort of simple chiropractor and that I'm only going to offer to adjust their knees. And that's why we teach everyone that I am a primary care physician and I'm a chiropractic physician, as well as the internal medicine doctor. And we tie all of that together, that their musculoskeletal problem may have something to do with a visceral organ instead. But with the eyes, the fluid will pool in the eyes just like a hand or a foot, because that pressure has reached the end of the line. When that fluid goes up into the skull in the cranium, it can't go anywhere else, and it will come out through the pores. In this case, the biggest pores are the ears, the nose, and the eyes. So a lot of our sinus problems are actually kidneys. A lot of our hearing problems, like a lot of tinnitus and vertigo from hearing problems and the inner ear, is actually a pressure problem from the kidneys and the inflammation that's in their bloodstream pushing on the inner cranial parts of their brain. But the other thing I'd like to tie in that's a little different than what Crystal has seen is the dark circle coloring, even if it's not directly under the eyes. That is a classic manifestation of the actual immune system response from the red blood cells and the white blood cells when there is an actual allergic reaction.
Yep, absolutely.
It takes a special chemical reaction to form that discoloration. It's not a bruise. It's not like you're leaking blood, although that is possible. The eyes will also show if you've had intracranial trauma. The eyes can bleed. The whites can become bloodshot, but those are different problems. The dark circles are related to an oxygenation problem in the blood. And the best example I can teach you is what we call rusting or oxidation. When you have too much oxidation in your body, your cells will literally turn dark.
Right.
And it's the same thing as rusting, which is why you hear people talk about using antioxidants to fight the anti-inflammation, because the oxidation is what's occurring. The other cause is heavy metal poisoning. That will show up as dark circles because the metals are actually dark in color.
Especially
You
mercury.
also can run into a situation where you have certain other conditions, including liver and some stomach conditions. And going back to the stomach, like Crystal said, we don't ever recommend anyone taking a proton pump inhibitor or a stomach acid blocker like
Thank you.
Pepsid or anything like that, or omeprazole is the drug name, because that will not only delete the acid that you are supposed to have, but it will mess up the sodium and the phosphorus and a couple of other things.
So, okay, let me hear this again. You said do not take antacids.
Yes, don't. It stops your
Never.
stomach from creating that hydrochloric acid needed to it's like an enzyme to make enzymes to digest your food. And if you stop digesting your food, then and you keep thinking, oh my gosh, why do I still keep burping up all this stuff? And you start popping those Prevacid, the purple pill or whatever it is, and it just keeps. It's just like a chain reaction. And then when you get off of it, your body and you know you're trying to actually do the right way, right, and start eating better foods and everything. Your body says, oh no, so you get right back on it. It's literally it was made for people to like basically get addicted to it because they think they need it. But what really happens is they just need to get their body some enzymes, some better probiotics in it, take out the dairy, the gluten, the the flours, the added sugars, you know, all the refined carbs and, you know, processed foods. That's what you need to get rid of. Get rid of the mucus and inflammation creating foods.
And remember, your immune system is mostly protected by your stomach. Every bug you come in contact that you swallow, you will get the infection. So people on the antacids are highly prone to getting sick more often, especially gastrointestinal sickness.
Especially like you said, the immune system, it's in the gut. 80% of your immune system is in your gut. And if you're feeling things, it's gonna mess up your gut. You get that little foreign invader that comes in, someone that's not supposed to be there. Your body takes so much energy. It goes to war basically. It gets all these little guys and says, we got to go to war. There's some kind of foreign invader here. We've got to get them out. And it goes and tries to attack it. And your body you might get tired. You might get joint aches because your body is taking so much energy to get that guy out of your gut. And so it's saying you need to rest or you need to do this. It's creating what happens when you have muscle pain. You stop doing what you're doing, right? Like you're not gonna keep trying to make that muscle more sore. So it's that's your body saying you need to rest. You need this. Just listen to your body.
So when it comes to the eyes, because I'm going to keep on track here because I got too many people that really are interested in this, and I know that it all ties in together. But specifically on the eyes, if it's already shown on the outside, that means that the inside is really, really needing help.
Correct.
So if we see dark, I think I have dark circles under my eyes. I don't know if you guys think that, but I think I do. And so I think that they could be, I mean, I don't know. I see this and I have issues with that. Okay. Right. So I want to know for my own self, and I know I've heard all that what we just said. I don't want to rehash, but I would like to ask about the eye floaters and the twitching of the eyes. So if we can touch on those two things, that'd be really great.
I was just going to tie it into the twitching and then go on to the floaters. You read my mind.
One is the lack of calcium. I just want to say that about the eye twitching. The lack of calcium and magnesium too. You can't have magnesium without calcium. But usually when the body is stressed and you're going under a bunch of any type of stress, happy could be stress. It doesn't have to be bad stress. But when your body's just under so much stress, it takes more calcium to heal. So a lot of times when our eye starts twitching, it's probably because we're depleted of minerals.
And Crystal took that one perfectly. The electrolytes, calcium, magnesium, potassium, are very, very sensitive. The twitching is usually a muscle that is depleted in those three, one, two, or three of those. And that's a sign of stress reaction, which also goes back to the endocrine system for the cortisol hormone that your body creates.
And you can get leg cramps too. Like if you have enough calcium, potassium, and magnesium, that'll help with that too. Just want to mention that.
Also, the deltoid muscle right on the side of the shoulder on the top of the arm is very common for that twitch to show up when it's a deficiency like that. Or right on the side of your thigh. Sometimes.
So I guess what I'm hearing is that eye twitching is a lack of calcium, magnesium,
potassium,
and normal like minerals that need to be brought into the body. So it's a lack of those things that need to be brought into the diet.
Right.
Yes, but that is secondary to the primary condition, which is almost always an over prolonged stress response that's ongoing.
Yep. And medications deplete those minerals, by the way.
Right.
Okay. Well, all medications or some?
All.
Okay.
The way they make a pharmaceutical drug, the way that it's processed in the petri dishes when they make it, they automatically deplete those minerals.
Like B vitamins too, especially. People get very.
B vitamins. Yep. Coenzyme Q10 is another big one. CoQ10. That one always gets depleted. Always.
And you need those B vitamins, and you need vitamin A for eye health. You know, you need all those things are very important for eye health. And zinc too. Zinc, the eye has a lot of zinc in it actually. So it needs zinc to create those enzymes to help, reduce that inflammation that you could have eye pressure from like glaucoma and stuff. Anything, if you ever have macular degeneration, glaucoma, cataracts, whatever the eye thing is, bad night vision, you're going to need high forms of vitamin A. You're going to need zinc. You're going to need those other minerals. You're going to need B vitamins. Your body is depleted in those things, and it needs all those things to work better. Like vitamin A can't just work on its own. Like I said, with calcium, magnesium, you have to have magnesium for calcium to absorb better. So you need those other B vitamins and things and zinc to absorb vitamin A. And when
it comes to the floaters, tell me about those real quick because we're about to run out of time.
Parasites.
The floaters are always related to a circulatory problem that has caused damage to the inside of the eyeball. So we're getting into a different category here, but they are related to vitamins and minerals. So when you have a circulatory problem of any kind, and there are many kinds of cardiovascular and circulatory problems, the back of the eye, the only living part of the eye, which is called the macula, has been overpressurized, such as high blood pressure, or it has been underpressurized because of lack of blood flow due to a clogging of the arteries or something else that's occluding the blood flow, or it's been deprived of oxygen due to any of those reasons. And it's kind of like a little tiny transient ischemic attack for your eyeball. And those floaters are part of the back of the eye that have been damaged, and the macula cannot see anything on those spots.
Now those can come and go though. Like they don't necessarily have to like be a permanent damage.
Correct. That's why we call it transient. But if you have those long enough, you will develop a permanent problem. And that's when people end up getting rushed to the hospital and things like that.
Okay.
Sugar is a big deal with your eyes. You have to control. We said this last time too, but I can't reiterate it enough that having diabetes, having high blood sugar, and too much insulin or whatever, too little insulin, that all relates to your eye health. A lot of people build up eye pressure, and that's why they get glaucoma and cataracts from the sugar issues. You'll have a lot of changes in your eyesight when you have blood sugar issues, and a lot of people, what they don't know is that vitamin A is so important for your eye health, but it's also important for liver health. And it can help your liver because your liver has over 500 functions. That nourishes your liver to do all of those functions it needs to do, and it helps to detoxify and things. And also, when you think about the liver, think about hormones and blood sugar. Because when you help the liver, you will also help your blood sugar levels as well. So it's really important to know how all those things are kind of interconnected.
The liver controls blood sugar all day long.
Absolutely.
So, Dr. Hollis, we have 5 different ways the body can filter things out. And I know I'm throwing this one at you. What are the 5 different things that the body needs to filter out toxins?
You mean the 5 different ways, or 5 different things that it needs?
Well,
no, 5 different ways.
Like the lungs, the kidneys, the liver.
So in order, it's kidneys, liver, lungs, skin, and sweat glands.
Okay. Okay.
Arguments about some other ways.
But those are the main ones.
Correct.
Okay. And it sounds like each one of those needs the other to filter correctly. Okay.
Yes, and they share the load. If one of them becomes overwhelmed, the others will step up and do more.
Right. Like when, for instance, your liver, if it's overly congested, you might have eczema, psoriasis, that's inflammation. It's coming out through the skin because it wasn't filtering out through the kidneys and the liver first. So it comes out through your skin.
Right. Hives, allergic reactions, contact dermatitis.
Leaky gut,
Leaky gut.
The dysbiosis, the overgrowth of yeast, bacteria, candida, all those things.
Well, and remember, it doesn't always mean that you have a problem with the organ, like it's failing. You could just be exposed to too many toxins and they can't keep up.
Right.
Which is why we're concerned about leaky gut syndrome and the extra inflammation that you produce systemically in your whole body, because that then makes your kidneys and liver work harder.
Right.
Which in the long run can damage them. But it doesn't always mean that you have a liver or kidney problem, even if you have eczema or psoriasis. What it means is they can't keep up.
Yeah.
Eventually, that can cause damage.
Right. Sorry. Right. I was just saying they need to be nourished. They need to be cleansed. There's so many things.
I could actually sit here and be talking to you guys forever, but it's 1:47, and I know you have the rest of your day to get to, Dr. Hollis, and so do we. But I have more questions. But the eye situation is fantastic. We still need to talk about, excuse me, toxins that seep in through the skin. That includes makeup. That includes hair. That includes perfumes. All of that stuff. Even shower water, you guys. Our shower water has toxins that go through our skin. So that could be our next thing that you want. Because I know that you wanted to talk about that as well. And it could all tie into the eye, the sinuses, the brain, all of that still. And it's never too, we can never talk about things too much to me. Because again, everything hinges off of something else. So when we talk about these things the holistic way, it's going to continue to piggyback off of the same things over and over again. And some people need to hear things 10 times in order for it to sink in.
Right.
So
and I want to leave with that something very, very important.
Okay.
The eyes are the windows into the soul. Not just the eye socket and the skin around the eyes, but the sclera, the white part of the eyes. We were talking about stress and high blood pressure earlier and the eyes twitching. That is because of that stress not having an avenue to get out of your body. So that whole roller coaster with that whole downward spiral of the stress response, how your body responds to stress, could be its whole conversation by itself.
Exactly.
But to tie that into the eyes have 5 compartments that tell you different parts about the body in different areas. So there's the bags, there's the circles around it, there's the white part of the eye, and then as Crystal knows a lot about, the study of iridology to actually look and see what the pupil and the cornea are telling us about the health of your internal organs. We can know that just by looking at the eye. And so that's one of the services she and I both offer, the iridology, where we actually can take up close pictures, and it's like reading a map trying to find a campground. We can tell you exactly where your problems are coming from.
Right.
Yep. And it's pretty accurate, you guys. It's very, it's almost like as unique as your thumbprint or your fingerprint. your eyes are that special and that individual.
Mhm.
And it can go back it goes back 4 generations of health in your body.
That's
And
right.
the beautiful thing about it is that before you have children, you can change your genetic print on the next person that you produce. So your children don't necessarily have to take on the same genetic thing that you had from
Right.
your parents if you divert them by someone looking in your eye and telling you. It's just an amazing thing. So we can even have a whole conversation about iridology as well, because that's so important. And I am going to take that class, by the way. So I will be an iridologist pretty soon here. I'm very excited about that. Yeah, because I'm really excited in learning how to map out people, especially before they have children. That's going to be my targeted persons to try to help them divert that whole genetic thumbprint that we don't have to pass on to our next generations. That's such an amazing thing to me. Oh my God.
We should put that on the list for one of our talks.
Absolutely.
Oh yeah, absolutely. All right. So, Dr. Hollis, I want to thank you again. I want to thank you again and again for being such a wonderful participant, for knowing so much, for just being you, being gentle with how even the way you explain things is just so we can understand it. And I love that. And I know that, like I said, when I send out your tapes, people are like, yeah, I like that guy. So
Thank you for having me.
oh,
Yep.
absolutely, absolutely. Crystal, you know you're amazing. And I absolutely thank you for your knowledge as well, and for teaching me what I know, the little bit that I know. I'm learning, I'm getting there. But yeah, so you guys, thank you so much for joining us on Wellness Wednesday. We are so happy for each and every one of you that take on our programs every Wellness Wednesday. We absolutely love bringing you new ideas and new knowledge so that you'll know how to handle things from this point forward. And we just pray that you guys have a wonderful rest of your day, wonderful rest of your week. And Dr. Hollis, we'll see you next month.
All right.
Thank you.
Thank
All
you
right.
so
So you
much.
guys, when you are healthy and wealthy, your health is wealth. And when you're green inside, you are clean inside. Thank you guys for joining us.
Thank
Bye.
you. Have a great day. Thank you.
Thank